So periodontal disease in dogs and cats, probably 70% of the patients we see at Vet and PVet Hospital for whatever reason suffer from some level of periodontal disease. The point with periodontal disease, which is an inflammation of the gums and calculus plaque deposit on the teeth, is that it can be prevented, but once it has started, it can only be managed. So there's two things that we look for when we're looking at periodontal disease, and certainly one is an inflamed gum, and we don't. So if we have swollen, inflamed red gums, that's part one. And then part two is whether we have plaque and calculus that are deposited on the teeth. So the problem with periodontal disease is once it has started, we can only manage it because we certainly don't want to lose the attachment of the tooth, which is the gum that becomes swollen, the bone that holds the tooth together, and the ligaments that keep it together. So we have to keep that tooth healthy as possible. There are certainly risk factors to develop periodontal disease in dogs, and age, of course. As we age, dogs will develop deep pockets in there. The breed, so the toy breed, the small dogs, all dogs have 42 teeth. So whether they're a Great Dane or a little Chihuahua, they all have 42 teeth. So the Yorkies and the small dogs, their teeth are far more crowded. So we have more issues with that. Malocclusion, some dogs will have an overbite and an underbite. Charlotte has a perfect bite, but some of them will be over and under. That means the food particles don't get moved around very well. Being on soft food can be a problem, and the crowding of teeth, which we see a lot in the brachycephalic breeds, the breeds that have their face pushed in a little bit, so the boxers and the cute Frenchies. The idea is we still have 42 teeth, but they're going in all different directions. And then often the lack of oral care is part of the problem, especially as they age. So periodontal disease is something that we can manage once it has started. Now, a lot of people will ask us about, hey, should we go for cosmetic cleaning? I'm really iffy about the gentle cleaning or cosmetic cleaning. And the reason for that is, I don't care if it's cosmetic. What I want is a functional tooth clean here. So when we end up using this, something like that to scrape the tartar, and you have to be so gentle, because remember we talked about the enamel in dogs and cats' teeth is only 0.2 to 0.3 millimeters thick. So if we're scraping really hard, we can disrupt the enamel, especially if we're not polishing after. We're making streaks in there where it's easier for the bacteria to attach. The other thing as well is when we're cleaning, it's far easier to clean toward the front. But remember, we have 2 molars in the back, and on the lower teeth as well, we have 3 premolars. So it's very difficult to go clean the teeth, and we have to go on the inside because tartar will deposit just as much on the inside than the outside. So often those areas don't get cleaned very well. So by the time there is a problem that has disrupted the gum attachment, then it is too late. We have to do far more invasive work. Points to remember. So of course, periodontal disease can be prevented, but once it's started, it can only be managed. The gold standard is still brushing teeth, and that should be done every 2 days. After 2 days, the nice biofilm that is just a little bit of plaque has become calculus. So we have to go at least every 2 days. So some people say, I brush my dog's teeth every Sunday. Good effort, but probably not enough. And then finally is make sure that your dog finds it a positive experience to have their mouth handled. We want this to be really nice and positive for them.